Welcome back to all of you who joined us for the earlier session, and welcome to everyone who is tuning in now. We are very pleased to have you for our 5th edition of the Human Security and Development Forum on the topic of Europe and Asia fighting COVID-19 together, mutual lessons from the pandemic. And welcome to the second panel, which is from COVID to COVAX, the experiences from the Korean Peninsula and Singapore. It is a very special edition, partly because we have 2 panels, but also partly because we've tried to branch out to other parts of Asia out of the Korean Peninsula in the first panel, but we will slightly do so also now with the first presentation. But the main focus of this panel is sort of zooming in on the Korean Peninsula, both the south and the north. My name is Dr. Tereza Novotná. I am a Korea Europe Center Fellow here at the Institute for Korean Studies, but I am also a Korea Foundation Fellow at the Center for European Integration at FUBerlin. So let me move now more to the theme of this panel. Since over a year and a half, the world has been fighting the COVID-19 pandemic, and Korean Peninsula is actually quite an interesting sort of laboratory in a sense that the South and the North represent almost 2 ideal types or 2 models of how to deal with the pandemic. While the DPRK managed the outbreak by imposing strict lockdowns and sealing off the borders, we could say it's more or less going in the footsteps of what China initially did. South Korea is a great example of an opposite approach that is avoiding shutting down the country and using big data and artificial intelligence. But paradoxically, on the whole, at least at the beginning of the crisis, both Koreas and I would say Asia in general did fairly better than Europe in terms of number of cases, hospitalizations, and fatalities. So of course, when it comes to DPRK, we always have to bear in mind difficult access to proper data. Yet now, when we are in the second phase, when various vaccines have become available, South Korea has been sort of lagging behind Europe in vaccine procurement and production. Although it has rapidly increased the inoculation rates, it has sort of played the catch-up with Europe. And of course, in the north, we have so far not have any vaccines delivered yet. And we will discuss all circumstances around that and also the impact of that on the humanitarian situation in the country. So we will start with Dr. Erwin, who will talk about the case for Socio-Community Hardening against COVID-19, a comparative study of South Korea and Singapore. So we will start with the southern part of the peninsula. He's associate professor at Hankuk University of Foreign Studies in South Korea. His research interests include inter-Korean relations, security and diplomacy in the Indo-Pacific and geostrategy. But he has also been working on anti-pandemic measures in South Korea, Singapore, and Taiwan. So Erwin has already started with his screen sharing, I believe. So the floor is yours, Erwin. Thank you.
Okay, great. Thanks. So the political cartoon that I've used to set the scene for my discussion in many ways illustrates some of the points I'm getting at. You can see the woman on the left insisting on her rights not to wear masking and the like, in many ways reflective of the emergence of the current phenomenon that has gripped much of the anti-mask, anti-vax movement since last year. On the right, you have another woman who's suffering from the impact of COVID-19 and actually ironically showing somewhat more concern for the woman on the left whose rights are allegedly being infringed on. So I like the juxtaposition of these 2 images in as much as it reflects the debate over rights versus responsibilities. Thereby, under which circumstance, it underscores the point I'm trying to make in this discussion, namely the need to engage in socio-community hardening against a whole range of non-traditional threats. Now, a bit of a brief disclaimer. You're not going to find the term socio-community hardening in the Wikipedia or in academic literature. So I've decided to break down my discussion into the following 4 components, beginning with a brief discussion on what I call socio-community hardening. As I was alluding to earlier, the term doesn't appear in the academic literature. I use it as an organizing theme to reflect the need to harden communities against non-traditional security threats. 2 case studies on the ROK in Singapore, from which I then draw my conclusion. So in the sense that I coined the term socio-community hardening as an ongoing research project to consider how how states and sub-state entities may address various non-traditional security challenges, not just pandemics, but also climate change and lone wolf terrorism. In this sense, it underscores the necessity of strengthening the resilience of communities, as well as ensuring that states, as well as sub-state actors, are able to have a full range of adaptable measures that can be implemented at short notice against unexpected challenges. In a sense that it reflects the situation that has been underscored by COVID-19, namely the necessity of ensuring the full mobilization of society to meet such challenges. At the same time, however, I think if you think in terms of the various instances of non-compliance with public health measures, I think it also underscores the necessity of a willingness to impose tough penalties against non-compliance with the public interests. Furthermore, if you also consider the extent to which fake news and misinformation behind COVID-19 has complicated public health efforts, I think it's also necessary for the socio-community hardening process to also underscore appreciation of the implications of cyberspace. So I have to come up with a rather abbreviated version of this discussion, but I'm happy to address any questions during the Q&A. Within the South Korean context, South Korea being one of the countries which has been lauded by the international community for its public health response, there was a whole range of measures that did work. For starters, South Korea had learned quite a bit from the MERS 2015 outbreak, as a result of which the South Korean authorities were fully aware of the need for transparent management of public health data as a means of establishing trust between the public institutions and the general public. Moreover, realizing that pandemics and viral outbreaks represent a game of whack-a-mole, the South Korean government is fully aware of the need to nip it in the bud as much as possible, hence the strategy of widespread and aggressive testing in order to mitigate outbreaks and thus ensure that the spreading virus would not overwhelm the public institutions. Now, in order to ensure a rapid response, the South Korean government realized that an overly centralized government response would be too slow to implement, too slow to cope with the unexpected and the rapid spread of COVID-19. So instead of an overly centralized government response, what the South Korean government did was to essentially delegate testing facilities to competent local government officials on the grounds that this would enable local government officials at the district level to respond to a rapidly spreading outbreak. And as mentioned, the necessity of the rapid test procedure was reflected in the ROK's innovative use of drive-through and walk-in test sites. The South Korean government also should be lauded for recognizing the need to ensure that marginalized communities were not excluded from the public health measures. So in this sense, one of the things that the South Korean government was praised for was their willingness to grant amnesties to transient workers with expired work visas, sex workers, etc., and other marginalized communities where, in absence of testing, ran the risk of causing the virus to spread further. Now, more recently, though, with the government's attempts to ramp up the vaccination process, the government of South Korea has also begun imposing penalties for the spreading of misinformation online, although this has taken effect only within the context of this summer. Now, that being said, the ROK's track record has also been marked by a series of shortfalls. This range from mixed levels of public trust. For instance, in early 2020, the South Koreans government was praised for the introduction of the Corona 100-meter app, which basically had a phone that alerted users to whenever they were within 100 meters of a known COVID infection. However, the reality was that the Corona 100M app had a download rate of only 8% of the entire population of South Korea. Now, given that a 60% download rate was necessary to achieve herd immunity, this reflected a bit of a shortfall on the part of the ROK authorities. Elsewhere, during the summer of 2020, there were other revelations as well, namely the fact that it was found that NAVA had been using a data center in Hong Kong to store the individual's private data that was being collected on Corona 100M app. So also during the summer of 2020, there was also a revelation that hackers could essentially decode the identities of people using the app, and as a result of which it was possible to reveal their public data. A further shortfall on the part of the ROK was a mixed record when it came to seeking inclusiveness. As I said, the South Korean government did make an attempt to ensure that to maximize coverage of its public health testing strategy, but there were also a number of other shortfalls in this regard. Part of this stemmed from the conservative ostracism of the LGBTQ community, which resulted in many members of this community being very half-hearted in offering their phone numbers to assist in the contact tracing process. This was one of the factors that led to an early outbreak in the Itaewon sector due to the prevalence of the LGBTQ clubs in that district. More recently, in early this year, following an outbreak in the Gyeonggi-do province area, the government apparently panicked and apparently made an instruction to all expatriate workers, but not Koreans, to be mandatorily tested for COVID-19. A third series of shortfalls came in the sense that the RK adopted tough measures in a manner that was too little too late. For instance, in the late summer outbreak of 2020, the government was reluctant to face the consequences of public economic hardship, as a result of which the RK government was very late in implementing tough social distancing measures. Moreover, if you consider the church groups that were behind the outbreaks of 2020, it is notable that the South Korean government was also late to impose tough measures, even to the extent of essentially finding a number of these churches not guilty of failure to cooperate with public health measures. Likewise, the establishment of an online fact-checking database to counter vaccine misinformation came only in February of 2021. Now, moving on to my Singapore case study. As with South Korea, a mixed track record. So what works for Singapore? As with the South Korean instance, comprehensive rapid contact tracing that basically meant that public health authorities didn't have to play a game of whack-a-mole against COVID-19. As with South Korea, also the transparent management of public health data. Somewhat more controversial, however, was the Singapore government's willingness to invoke the POFMA, the Protection from Online Falsehoods and Manipulation Act, that had been passed prior in 2019, shortly before the outbreak of the COVID-19. Now, in so doing, the Singapore government was willing to impose tough penalties against many Singaporeans for spreading of fake news information concerning the virus, for instance, shortages of masks or alternatively downplaying the seriousness of the virus. In addition, the Singapore government was also willing to impose other tough measures. For instance, extremely heavy fines and jail sentences for willful violation of public health guidelines, such as the failure to observe social distancing and mask wearing. As with South Korea, there were also a number of shortfalls in dealing with COVID-19. As with South Korea, the Singapore government used a number of apps, these being Trace Together and Safe Entry. Now, the Singapore government did not make download of these apps mandatory. It was voluntary. But it's also notable that the Singapore government also passed legislation requiring that any person wanting to use public institutions such as supermarkets or shopping malls had to download Safe Entry in order to be scanned to be allowed inside. In other words, then, in order to have any and to be able to enjoy the benefits of public life, one needed to have the Safe Entry app downloaded. In so doing, and in line with concerns of government overreach, the Singapore government attempted to assure the general public that phone data gathered through these apps would be limited to contact tracers employed by the Ministry of Health and would not be made available for police operations. Which didn't go according to plan, given that in January of 2021, the government itself admitted that the data that was being gathered from individuals' phone records was now being made available for police operations. So much so that the February 2021 Temporary Measures Amendment was, in this sense, a bit of a case of too little, too late in restoring public trust. A further shortfall in this regard was evident as early as 2020, if you think in terms of the outbreak within the transient worker community. In the sense that a large number of Singaporeans have this not in my backyard or NIMBY mentality, in the sense that there was a general high willingness to support tough measures against willful violation of public health guidelines, but at the same time, it is notable that the majority of Singaporeans were reluctant to accept these measures if they involved actual inconvenience to their own self-interest and privacy. So in this sense, they had very high levels of public reservations over the increased use of CCTV surveillance of people under quarantine. And these shortfalls was one of the factors that contributed to the outbreak within the transient worker community in Singapore between April to July of 2020. In the sense, the Singapore government essentially prioritized these very comprehensive public health measures for its own population, but at the same time disregarding the plight of the transient worker population. We are talking about laborers who are living in extremely overcrowded, unsanitary dormitories. Now, the Singapore government itself shot itself in the foot in this regard by over-centralizing power in its own hands, to the extent that it had a very low level of civil society buy-in. Thus, for instance, the NGO in Singapore, the Transient Workers Council organization, made repeated appeals to the Singapore government to pay attention to the unsanitary living conditions of the transient worker community, but was repeatedly ignored until it was a case of too little, too late. So if you take this abbreviated discussion of my ideas on socio-community hardening into account, And as we move forward in attempts to undertake vaccination against COVID-19, I think it reflects a whole range of challenges. These include the necessity of adopting a whole society approach on a so-called global scale. Not an easy task if you think in terms of the extent of COVID fatigue in many parts of the global north, as well as the domestic focus, which runs the risk of neglecting the so-called global south. Furthermore, if you also think in terms of the necessity of tough measures against the threat posed by fake news and disinformation, well, it's also a bit of a hard sell in public policy for most liberal democracies due to the concerns over freedom of speech. Moreover, I think if you take into account the extremely high level of hostility in conservative communities in the US against masking as well as vaccination, in many ways underscoring the kind of cult-like status enjoyed by certain purveyors of disinformation, so much so that it's now quite evident that in many cases in the US, you've got large numbers of followers of these sorts of disinformation who have essentially been brainwashed beyond recovery, to the extent that it might actually be necessary to impose even tougher law enforcement measures, but then this in turn turns us back to the problem of how to engage in public health policy without undermining civil liberties. And more recently though, is another interesting dimension to this, namely the increased willingness of a lot of people to print out fake vaccine cards in order to claim that they've already been vaccinated when they have not been vaccinated. So much so that I think it then takes us back to the issue of the unresolved and very difficult debate on rights versus responsibilities, insofar as the extent to which the government law enforcement measures are necessary in coping against COVID-19. But I'm happy to take any questions.
Once again, thank you very much, Erwin, for bridging sort of the first panel, which was about other parts of Asia, and this panel, which is mainly about the Korea, and sort of bringing up both the negative and positive sides of the anti-pandemic reaction in Singapore and Korea. I would now like to move to presentation by Jun Park, who will be talking about the case of South Korea's COVID-19 vaccine procurement task force and unequal access via the COVAX facility. In the earlier panel, we had you official talking a little bit about COVAX, so I'm very curious to hear how you see it from your point of view. And just a few words about June. So Dr. June Park, she is a 2021-2022 Fung Global Fellow at Princeton University. She was also previously a fellow at George Washington University, and she holds PhD from Boston University, my alma mater as well. So I'm always very happy to welcome fellows from BU. She's a political economist by training and works on mainly on trade, energy and tech in the US, East Asia and Europe. But her current work also is related to post-pandemic geo-economic conflicts and in general reactions to the pandemic in data governance and technology and other aspects. So June, thank you very much for joining us, and please, the virtual floor is yours.
So tonight in Seoul time and perhaps daytime in the European area, my name's Jun Park, and I've been working on a series of articles and publications just on the South Korean experience of COVID-19 for the past year. This year, as a fellow at Princeton, the original plan was to consolidate more work on contact tracing, but it got published already. So I'm expanding my research into the realms of vaccine procurement and development. The development part of vaccines in the South Korean experience is a little bit premature to put it into context from the social science perspective. Probably more in the sense of natural science perspective, there may be more to write about. But at the moment, I think what's essential is how, very successful case of pandemic governance in the South Korean sense for the earlier pandemic, the earlier stage of the pandemic, is comparable to the procedures of procurement of vaccines and what went wrong, what was supposed to happen, what would have been better. These kinds of things need to be addressed in the social science sense. And I think that's the literature gap that's really missing. So for the article I'm doing for Frontiers in Political Science, this research is a very preliminary sort of fact-finding search it's in the preliminary stage. And what I'd like to do is build on from here and to see more into the bureaucracies and decision-making patterns of how vaccines were procured from the South Korean perspective and what went wrong in there. And we can discuss this more in the Q&A, but first, let's start off with the presentation. You see 5 photos here. You see vaccines. I didn't put tabs on them because there are several kinds. You see the vaccination plans being announced, different bureaucrats from different ministries. You see public health officials, as well as the one who's addressing the public here in the conference is a military official. Then you see in the middle the cargo plane, Korean Air cargo plane, unloading the Pfizer vaccines through UPS. Basically, the Pfizer vaccines have been a little bit more meticulous, more difficult in the sense that they get procured from one certain site. And you see the 4th picture here, which is Samsung Biologics in Songdo, where I used to work. When I used to teach at George Mason Songdo, it was right in front of the front yard. This is where the Moderna vaccines would be produced under a license. And then at the end, you have the COVID vaccine reservation portal, which you can access through your cell phone or your laptop or whichever gadget you would have to use on the internet just to make your reservation. So this research supposedly in my own plan is to cover all of these stages and to see what went wrong, what was formidable, what was lacking in terms of public policy making. Here you see the share of people vaccinated against COVID-19. This is from actually Monday, when I first prepared for the presentation. So South Korea is picking up pretty rapidly in recent weeks, but still there is a host of population that is still lacking the second dose, including myself. I received my first shot. I'm in the age range of 18 to under 64. And I received my first vaccine dose on the 13th of September, and my second dose is scheduled for 18th of October, Pfizer. And as you can see, the plans have not been according to plan, mainly because there was a procurement issue. There was a little bit of ups and downs at the factory. These kinds of things have led to difficulties in terms of inoculation plan. And if you compare with, even countries like Spain or Italy, even in Europe, you see that there is a discrepancy here, and it has to do with the early procurement of vaccines. Here you have vaccination by city and province in South Korea, first dose, second dose. And you should note that 1/5 of the population lives in the Seoul, greater Seoul area. So when you get the sense of, that population concentration, of course, Seoul naturally would have more vaccinated people than in other areas, but still you see some disparities by regional, vaccinated people in terms of population, both first and second doses. And if you see an international comparison here, what's comparable is the case of Japan and South Korea. Japan has had an earlier procurement through the US, the Pfizer vaccine. South Korea was a lot later than in the procurement stage. But in terms of the inoculation plan itself, I think South Korea picked up pretty fast. If you compare it with the US and European countries, even the UK is a comparable, the adoption and approval process, it was a lot more earlier than what South Korea went through. So if you just look at South Korea with the transatlantic countries here, you see that the late procurement in February, a late start date, and slow speed was the beginning of South Korea's vaccination plan. And this started to change because there was a motive in order to pick up the vaccination speed. And let's try to look at the political factors as well later on in the slides. Here is a divided dimension of what kind of categories and what kind of age range, what kind of populace was able to get the vaccine depending on the procurement quarter. And as I explained, because there was a shortage in the earlier delivery, the vaccination in the earlier stages. The first quarter, it was mainly AstraZeneca vaccines produced by SK Bioscience under a license, meaning that a South Korean company was producing on behalf of somebody else. And that wasn't enough. And the controversies regarding the AC vaccine also stirred a lot of public unrest in South Korea regarding its defects and regarding what kind of side effects you may have. But later on, the discussion led to the whole array of different kinds of vaccines, what kind of side effects you could have from the first dose, second dose, depending on which vaccine. And now we are entering Q4, where the unvaccinated and teenagers, pregnant women are also able to get vaccinated. And going on from Q3 to Q4, I think what we'll see into the later months of this, the latter part of this year in Q4, is the completion of the second dose and perhaps the beginning of the booster shots. Now, looking at the political factors, I think this is quite essential in looking at what this actually means politically, because in the past year, my work has mainly been pinpointing on the fact that any political leadership, mostly if a democracy, when it cannot deliver on pandemic governance, the leadership is doomed to fail in terms of public acceptance and approval. And this is a moment where the South Korean leadership is being tested mainly on the premise of pandemic governance performance, because vaccine procurement is just as important as contact tracing or testing or any other effort that is utilized in order to make this go away. And here you see, this is a Gallup Korea data. You see that the earlier response methods, they begin to lose steam from the end of last year, so last winter. Because people are getting anxious about vaccine procurement, people have access to international news. They hear news from Israel, the UK, the US about the developments of the vaccine, and they're worried that the vaccines may not come in time and that they would be falling behind. And since last winter, the disapproval of the dissatisfactory evaluation rates have not gone down. And one of the crucial reasons, if you assess the factors of this dissatisfaction, it points to the laggard vaccination process due to the late procurement. And everybody keeps on, discussing this at a higher level, criticizing some of the high-level bureaucrats who were appointed by the the Blue House to procure the vaccines, but were discouraged to. And then the discussion just goes on and on and on, putting heavy burdens on the actual people who need to do this work. So the Blue House places more emphasis day by day just to finalize this process. There is a big political motive because there's a presidential election in March 9th. Just looking at the types of vaccines, this table is being updated by me. Actually, the other columns could not be added here because I think the earlier table created by Dr. Jung here, it was very useful, but this is dated February, so there have been lots of updates. The important part that I updated that I would like to share is at the right, which has to do with the international nexus of vaccine procurement. Pfizer vaccines to South Korea, they've only been procured via COVAX or contracts, individual contracts, or swaps with other countries. And in the Moderna vaccines case, the USROK summit had a lot to do with the MOUs and the production agreement, just like SK Bioscience for AstraZeneca. They would be producing on behalf of Moderna here based on the smart factory establishment they have in Songdo. Then the AstraZeneca vaccines, as I said, is also being produced under a license here. And the USROK summit for J&J, this was also the source of controversy because they were close to expiration. And the USROK summit brought, at the end of the summit, South Korea was able to procure some of the J&J vaccines for those that are on reserve for the military or military personnel. but it wasn't enough. The fact that it has a lower efficacy rate also raised eyebrows amongst the South Korean public, although it had a high participation rate in terms of reservation. Novavax, there's an MOU that was reached at the USRK summit for R&D. So we'll see more of these things. The culmination of the summit really led to vaccine cooperation, but we are beginning to see these things. It's not for sure how this would unfold in terms of pandemic governance performance. We haven't seen the results yet. And what I'd like to point to in terms of the decision-making and the delivery part of the bureaucratic policy-making process is, the political pressure was so severe that even after procuring the earlier vaccines in the early part of 2021, there was a vaccine procurement task force established from April 1st. And if you see here, the pan-government vaccine delivery effort, different ministries having different sources of information, contacts, ways of procuring, because later on, as time went by, South Korean officials and the executive realized that this is not just a matter of procuring, as in buying a product from overseas. It's a question of diplomacy. It's also a question of geopolitics. So later on, what it became to is a more of a consolidated effort amongst ministries, not just public health authorities, but also, Ministry of Foreign Affairs, Ministry of Trade, Industry, and Economy. They had to come together and think about a plan to deliver in the right way within the period given. And this is how vaccines are procured, through group thinking at the moment. The red part here that I pointed to, there are different ministries here, of course, and I think you have a sense of what I've delivered from the previous line. The negotiation part here is very crucial, and it's kept very much veiled. It's not really revealed to the public how this goes, because vaccination companies do not reveal their contracts or data. But the prices have been known to the public. They were released. And the negotiation process, as for the schedules, the briefings reveal there is a negotiation between such and such. That level of information is given out to the public, but not to the detail specifics. And this is basically how the vaccine rollout mechanism works. And I think what South Korea has been doing well is in this area where the transport, cold chains, hospitals designated for vaccination, this works in a very speedy and efficient manner. Once you have information and approval to go to get vaccinated, then you can actually get a safe vaccination site scheduled for yourself. The issue mainly has to do with the negotiation part and the securing part, which is why the deployment, the procurement part is in question. And therefore, we are likely to see more of these challenges coming, should there be an additional one. And in the end, what South Korea will end up doing is through the R&D research efforts, collaborated efforts, South Korea will want its own vaccines and technology in order to avoid the kind of mistakes that were revealed during the 2021 earlier phase of the vaccination process. So I'll end it there.
Well, thank you very much. Thank you for ending with such a brilliant scheme. Thank you. Thank you for, pointing to sort of challenges that South Korea has been facing with the vaccines, which, if we think back for those who watched the earlier panel, it kind of goes hand in hand with problems that Taiwan or Hong Kong are being faced with too, which, it's interesting the fact that all these countries were quite successful in sort of suppressing the COVID-19 in the earlier stages of the pandemic. But now I would like to move to the northern part of the Korean Peninsula, and first with presentation of Ki Park, who will be talking about North Korea's COVID-19 response and vaccination capabilities. Just a few words about Key. He obtained his medical degree from Rutgers University. So as my father, who is a physician, would like to point out, he's the actual real doctor among us. He has been trained in neurosurgery at Temple University in Philadelphia. He's also director of North Korea program at the Korean American Medical Association and leads collaboration between the US and DPRK physicians, not just on COVID-19 but other issues. He is also a consultant for WHO on various issues. He's also a member of the National Committee on North Korea and member of Council of Korean Americans. So Key, please enlighten us about the COVID and vaccines in the DPRK.
Great. Yeah, thanks for inviting me. And I'm learning a lot this morning. I love how, in Korea, when there's like a task force, they all wear these jackets. I think we should get those jackets made next time. This makes you look like you're serious, Yeah, so let me just talk a little bit about North Korea. So for North Korea, the threat of the pandemic, the COVID-19, is more than just a public health emergency. It's really they see it as a national security threat. And if you look at the structure, the governance structure, the Ministry of Public Health is part of that, but it really is at the highest levels of governance that direct the policies. There's no question that North Korea, they've had experience with SARS, Ebola, and they've taken very early and aggressive steps at that time, and they did the exact same thing this time. They were the first country, even before China, to lock down their borders, and they sort of took early and aggressive measures to seal its borders, and they've maintained that since January of 2020. So this question is, could case of COVID sort of seep through the borders, this porous border between North Korea and China, ended up in North Korean country? Well, a couple of things about that. One is the number of cases in China, the two provinces that are adjacent to North Korean border, there aren't that many cases there in the first place, right? They're the Chinese have been very good at controlling the number of cases. And number two, even if there was an outbreak, an isolated case in any of the parts of North Korea, the public health system is quite strong, and they'll be able to identify the person, and also all their contacts be quarantined immediately. So even if there was a case of COVID, they should be able to control it just through these isolation measures. Now, people have questioned North Korea's statement about not having any COVID cases in North Korea. But if you look carefully on their statements, what they say is we have no confirmed cases of COVID-19 in our country. And let me just give you a little bit of background on their testing capabilities. My understanding is that when the outbreak happened last year, they had maybe one machine, the PCR machine in Pyongyang. They actually were trained in Hong Kong through WHO on how to use these machines. They tried to get additional testing kits and machines early on. I remember that they reached out to a number of external partners. From that time, I think they probably have between 20 to 30 machines in the entire country. So they've performed tests on maybe 35,000 people. Clearly not a nationwide testing protocol. So they have a very limited testing capabilities. So what could have happened is, and all the tests that they've performed have been negative, right? Even a suspected case out of Kaesong that ended up being inconclusive and negative, from my understanding. So when they say that we don't have any confirmed cases of COVID, I tend to believe them. I think it's too quick to just dismiss them as saying this is propaganda. And you can see the behaviors, right? These large public gatherings with the elite in presence without any masks. I don't think they would do that for propaganda purposes. They're very risk averse. So this shows a level of confidence in their policies. The other thing that I would mention is that, they passed recently on an offer of 3 million vaccines from COVAX. It's the Chinese vaccine, the Sinovac. And what their reason was, we're okay. Please use these vaccines for other countries that are, really, suffering severe outbreaks. From a public health standpoint, their measures, if the objective was to prevent the virus from the outbreak from happening, I would say they get high marks for that. Now, that is the good news. There are not unintended consequences or sort of side effect of these policies. And for sure, things like the economy is tanking, right? The trade with their main partner, China, is down 70, 80% from previous levels. So how does the economy sustain itself? For the poorest part of the country, I think, and the ones that depended on the trade with China, the poverty levels has to have been, it has gone up. There's clearly a degradation of health systems. If you look at the import of medical equipment and medicines since the pandemic has gone, it's down to a fraction of what they used to be. So how do you treat these infections? Now, they are importing antibiotics, but not at the level that they used to. So how do you treat these infections, other medical problems, and then maintain hospitals? The food insecurity problem is also compounding things. We know that poor nutrition is a risk factor for further diseases. And I'll be hearing from Juan as the next speaker talking about the cessation of humanitarian assistance programs. This is a very concerning problem for me. They have basically all international staff, the UNICEF, the WHO are now out of the country. I'm not sure how are they managing these urgent humanitarian programs, specifically the severe acute malnutrition population in North Korea, which number around 50,000, and it's typically handled by UNICEF. Are they getting the therapeutic nutrient that they need? Because otherwise they have a very high mortality rate. So I'd be very interested in hearing from Juan after me. So let's talk a little bit about the vaccines. North Korea wants vaccines. We know that because they applied immediately to the COVAX Advanced Market Commitment Program, which is for the poor countries. It's as a donation program. As soon as it was announced, and they filed their application at the end within the deadline, which was December of last year. They were provided, they were approved, and they were asked to provide a national deployment and vaccination plan, which they also submitted that as well. And it was approved by the WHO regional office in Delhi. But what's interesting is their choice of vaccines. They had initially agreed to AstraZeneca vaccine. And as June mentioned, there were some side effects that came up. So then they sent a letter to UNICEF and WHO saying, tell us more about these vaccines. They're very suspicious people. We know that, right? They're very careful. And so they said, we want to know more about this. And so there's a hold on sort of saying, let's take it, because they were offered nearly 2 million doses. But at the same time, they had also supply issues, which was that India, the source of this vaccine was going to be in India, Serum Institute of India. And the Indian government put a hold on any exports of vaccines for COVID. Because they were dealing with an outbreak in their own country. So right now they're on hold as far as what choice of vaccines. And then they were, as I mentioned, offered the Sinovac vaccine, and they passed on that. So let's talk a little bit about, what could North Korea actually handle as far as vaccine choices. There's been an initial assumption that their cold chain capabilities to transport and store vaccines is limited. So they could only maybe handle the AstraZeneca type of vaccine, which requires some simple refrigeration. The mRNA vaccines are, they require ultra cold temperatures between from -20 to maybe -70. And then people basically assume North Korea cannot handle these vaccines. And we did an analysis on North Korea's capabilities. And I think it's true, the cold chain capabilities they have, but it's probably not the ultra cold temperatures. But we also looked at their deployment capabilities, specifically their experience with national vaccination at the last measles outbreak in 2006 and 2007. As soon as there was an outbreak, they approached UNICEF, they acquired vaccines, and they deployed vaccines in two separate phases. Phase one, they vaccinated 6 million people in about 5 to 6 days. That's about 1 million doses a day that they're able to put into people's arms. Phase two was 10 million people nationwide, and they did that in 3 or 4 days. That's like 3 million doses of vaccine being delivered a day, which is quite impressive. So North Korea, under ideal conditions, can deliver the vaccines if they need to. So if you look at the mRNA vaccines, there's actually a little fine print on storage requirements. There's a way to store them under simple refrigeration conditions, 2 to 8 degrees Celsius, not freezers, but refrigerators, which North Korea we know has. But the only condition is that these vaccines then have to be used within 30 days. And we know from the measles vaccine deployment that they are able to deliver millions of doses per day under right conditions. So they can actually accept mRNA vaccines. And it'd be interesting to see if COVAX, which actually has access to mRNA vaccines, if they offered the Pfizer vaccine, for instance, to North Korea, whether they will accept or not. I would hope they do. Okay, so let me just talk a little bit about now mutual lessons. if you look at this, there's a group looked at different ways countries have prepared for global health pandemics. And there was an index that was created called Global Health Security Index. There's a massive group of experts. And North Korea was at sort of the bottom of this list. Top two are US and UK. We all know how this thing unfolded, right? The number of people that died. And certain countries that were low on this ranking list actually outperformed in some ways, if you look at the deaths from COVID. So that it shows you that, we don't know how to assess readiness in some ways. The other thing is this issue of medicalization of health. I think there's a certain amount of hubris by, let's say, US saying we are ready for any kind of pandemic because we can treat the heck out of it because we have the best medical system in the world. Well, that was a failed, experiment. It was actually tragic because we had so many people that died on this over-dependence on the ability to treat. Same thing with the vaccine. I'll get to that in a minute. And then this whole idea that Erwin talked about, the civil liberties aspects of it. It baffles my mind. Strong governance is what's really needed in times of pandemics, and people have to put away some of their individual civil liberties. And this has gotten to a point where it's harmful to everybody. And then the last thing I talk about, the mutual lesson, is the sanctions that these countries are under, UN sanctions, for instance. They have a humanitarian exemptions pathway, but it's a very lengthy process administratively and time-wise. It's gotten shorter, but it still doesn't. You need to ask permission to send in humanitarian goods, including PPEs and testing kits. These sanctions were never designed to deal with pandemics. And we need to revisit this whole idea of having to ask for permission in times of a global public health emergency. It just doesn't make any sense. And so I'll close with this story that I had conversation with a high-level diplomat at the UN from DPRK Korea. Just recently, a couple of months ago. They were sort of quarantining themselves for a year and a half. They came out because they got their vaccines. And I was able to have a conversation with them. And he said, Dr. Park, I'm so confused about what's going on. This pandemic, we're not getting a control over it. If everybody did what North Korea did, pandemic would have been over. And I just kind of paused right there and said, wait a minute. What he's suggesting is if the entire world came to a shutdown and did a complete isolation and simultaneously, right? So this is, just think about this for a second. If they're able to execute that, have everybody do a simultaneous 1 month lockdown, the virus cannot replicate because they cannot, so if you do a lockdown for every place, we can end the pandemic today, over the next 28 days if we made our mind to do it. I don't think that's feasible because of multiple reasons, mainly politics. But it was really interesting to see from North Korea's standpoint that their methods are working and that they just are confused why others don't follow their methods. Thank you.
Yes, well, thank you very much, Ki. That was brilliant to see, things from the other side of the peninsula and sort of to see it from their perspective, their point of view, and also pointing out to, what we often discuss, it's, their capabilities and so on. You also mentioned quite clearly impact on humanitarian condition. And I think this nicely brings us to the last speaker, Juan Blick-Paris, who's going to talk about the EU's humanitarian aid to the DPRK in times of the COVID-19 and beyond. So just a few words about Juan. He studied history at University College of London, at Oxford University and Ca' Foscari University in Italy. But apart from his academic background, he has very extensive public policy background. He has worked at the European Commission's Directorate for International Partnerships, or DG INTPA, for a few years, where he deals primarily with the implementation of the EU's humanitarian aid program to the DPRK, and on a policy dialogue on development and cooperation with South Korean governments and on inter-Korean issues. So I'm very much curious to hear about your sort of experience from practice. So Juan, please give us your insights.
Thank you very much, Tereza. Good morning, good afternoon, good evening. It's a real pleasure to participate in this really interesting event today. So I'm just going to start with a general overview of what we do in the DPRK and then move on more specifically to the impact of COVID. So I'll start by introducing the EU policy background. The Commission manages its interventions in line with the 2011 EU guiding principles for EU policy towards the DPRK, as well as the July 2017 Council conclusions on DPRK, which reaffirm the policy of critical engagement. This policy of critical engagement involves maintaining pressure through sanctions and other measures, while continuing limited ongoing support in compliance with the sanctions regime that directly addresses the needs of the civilian population. The Commission's Directorate General for International Partnerships, known as INTPA, as introduced by Tereza, funds a humanitarian aid program in the country. And this INTPA program in the country is actually an important part of the EU policy of critical engagement towards the DPRK, especially regarding the engagement component. So now I'll go into the INTPA program in a bit more detail. We believe that the humanitarian situation in the DPRK doesn't constitute a short-term crisis. Rather, the underlying challenges facing the country are structural, namely the impact of climate change, the country's limited arable land, declining soil fertility, the focus on the production of staple crops, high post-harvest losses, insufficient mechanization, and limited technical knowledge. And in response to these challenges, the INTPA program in the DPRK covers the areas of food security, nutrition, sustainable agriculture, health, water, and sanitation. And the two main objectives of this assistance are, firstly, to address people's fragile food and humanitarian situation, and also to pursue sectoral engagement and a trust-building process with the civil components of the DPRK authorities in our areas of intervention, primarily via what we call a food security office. So our assistance to the DPRK can be broken down into 5 separate components, and I'll go into more detail on these shortly. 1, a food security office in Pyongyang. 2, community-based food security projects. 3, partnership projects in food security. 4, the provision of agricultural supplies. And 5, projects supporting the health and socio-economic conditions of vulnerable elderly people and people with disabilities. So now on to what we call community-based food security projects. These projects aim at improving vulnerable groups' food situation and resilience by introducing cooperative farms and communities to new and more efficient agricultural, environmental, and managerial techniques and practices. So these projects are implemented by the few EU NGOs with a permanent office in the country. What we call partnership projects aim to establish partnerships between DPRK technical institutions, i.e. research institutes, academies, and universities, with foreign institutions to build their capacities to tackle food security related problems. So these projects tackle the needs for Korean technical ministries, institutions, and universities to upgrade their knowledge and strengthen their institutional capacity and initiate or build on best practices and lessons learned with foreign counterparts. We also respond to the mechanization needs in the country's agricultural system by delivering supplies. This consists of the provision to cooperative farms and communities of small and medium-scale agricultural, agroforestry, and food processing machinery. This component of our assistance has actually been decreasing over the past few years due to our policy of moving towards more transformational rather than transactional activities. On to the Food Security Office in Pyongyang. This is an office staffed by 2 international food security experts, and without an EU delegation, these 2 consultants working at the office are one of the main communications that DG INTPA has with DPRK authorities. The Food Security Office increases the overall quality of INTPA engagement with the DPRK. Its staff engage in technical dialogue with relevant DPRK authorities, monitor INTPA-funded projects, and provide regular feedback to us on areas such as the humanitarian situation. So aside from projects in food security, we also fund projects supporting the health and socio-economic conditions of certain particularly vulnerable groups in the country, namely people with disabilities and vulnerable elderly people. In addition to providing much needed medical care supplies to these beneficiaries, the projects have also been successful in going beyond the immediate project level and aiming to influence government policy and social attitudes to an extent. So while it wouldn't be correct, of course, to claim that these projects have been the main trigger for changes in social attitudes, it is at least partly true that they've contributed to an overall ongoing improvement in social attitudes over the past 10 years. Regarding disability, for example, it's now much more common to see people with disabilities in public than it was 10 years ago. Now, a few words on implementation difficulties of our program before COVID. So these issues which have a negative impact on the delivery of assistance to the country and its effectiveness. These comprise difficulties in obtaining access to accurate data and of obtaining permission to thoroughly monitor project activities, difficulties with local partners, the difficulty of making an impact at policy level, and the unintended impacts of the sanctions on the delivery of aid. Regarding the sanctions, we believe it is true that the process of obtaining a sanction derogation in order to import supplies has been improved significantly over the past years. Yet the issue of the banking channel remains. So the cash situation in the DPRK was already difficult before the pandemic, given the lack of a functioning banking channel for humanitarian agencies to send funds into the country in order to pay for project costs. And this led to a situation where staff of humanitarian agencies regularly carried cash physically into the country. This has been further impeded by COVID-19 restrictions, thereby creating additional liquidity problems, which brings us to the impact of COVID on our program, which in basic terms has led to a suspension of all INPA projects in the country. Our understanding is that the pandemic has likely considerably worsened the humanitarian situation in the country, although due to the current lack of access to the country, it's not possible to say with certainty to what extent this may be. So I'm sorry to Ki, who was hoping to get some more information from us on this. As already mentioned, even before the COVID-19 pandemic, the cash situation in the DPRK was already difficult for humanitarian organizations, given the lack of a functioning banking channel to send funds into the country to pay for local project costs. So since the closure of the borders, this has no longer been possible, while the need to pay for local costs has continued nevertheless, given that most humanitarian agencies have decided to keep their offices partially open. Humanitarian agencies have decided to keep their offices open at a minimal level, meaning that most of the local Korean staff are still going into the office. This decision has been taken on an individual basis by each agency in order to facilitate re-entry into the country when circumstances allow. Their concern is that closing an office fully could entail not being allowed to return to the country. However, this situation can't continue indefinitely. There are concerns surrounding the difficult liquidity situation, in particular for costs such as the food allowance for local staff that most NGOs still have to pay in cash. From a project management and a financial management perspective also, there are limits regarding how long a contract may be suspended. The maintenance of humanitarian project infrastructure in the DPRK is therefore becoming more and more untenable the longer it is that international staff and finance cannot be sent into the country. So in conclusion, despite the difficulties and low funding levels, our DPRK program has achieved results and aid manages to reach the most vulnerable. And aside from these results, the process of implementing the program represents one of the main existing communication channels between the DPRK authorities and the EU, albeit a non-political one. However, the COVID-19 pandemic has effectively led to a suspension of our program. And the longer that the situation continues, the more difficult it will be for humanitarian agencies to retain their presence in the country, and the more difficult it will become to maintain the validity of our existing contracts. Thank you.
Right. Well, thank you very much, Juan, for describing a rather sad situation. I would now like to open the floor for discussion. But before you all do it, let me just start the discussion first on my side, and maybe let's go in the reverse order. So first look at the DPRK, and then we can look at South Korea. You know, when it comes to the COVID situation in the DPRK, first of all, in terms of perhaps vaccines, as far as I know, one of the concerns within COVAX has been the issue of monitoring, or the fact that you might be able to deliver the vaccines to the borders, but then you may not be able to enter the borders, and therefore how can you ensure that, first of all, the vaccines reach the people that they should reach, but secondly, that they are even just distributed properly. So here you were describing the situation with measles, which sounds positive, but that was the time when there were actually, as far as I know, people from international organizations on the ground. So, I would be curious to know what your view, how to basically do at least some basic monitoring. And perhaps for Juan, in terms of the humanitarian aid, which, as you described quite well, is severely impacted, has there been any thinking to try to do it through also slightly different ways than before, and perhaps to cooperate still with those who are on the ground, which may not be Europeans, but are still in place? And, I'm not too sure how practically it could be really done, but sort of like trying to think outside of the box a bit more creatively. And so I'll let you two respond, and then we will move on to the next question.
I'll go first, Tereza. Great question. We get asked this a lot. Sort of when you say monitoring, what you don't say is we want people to watch where these vaccines go, right? That's the reason for the monitoring, at least in the North Korea context. So in North Korea, when they vaccinate their population, they know that it has to be a nationwide vaccination program. For COVID, that's absolutely the case. And for things like childhood vaccines, they get 97, 98% nationwide vaccination rates, and it's been verified by UNICEF. This idea that the vaccine will be diverted to a certain people, I think that's overhyped. The other thing is vaccines are not fungible. You really can't hoard these things or even sell these for anything else. You can't take, how many vaccines do you need? You get vaccinated and you're done. So it's hard to divert. North Korea has a need to immunize the entire country. So the idea that monitoring is necessary, I think, is probably unwarranted. Now, what the COVAX could demand is that they report back on what's happened to these doses. There's a difference between reporting versus a monitoring requirement, and I think they do require reporting. Now, the only thing I think the COVAX should do is make the same requirement for all the other countries. Do not give double standards for North Korea. I think that would be wrong at this time.
Thank you. Thank you, Juan. So maybe if I ask you also a question which just came from the audience, was Chuping, who was on the previous panel, which is the extent of acceptance or reservation by the DPRK counterparts when you shift the program to be more transformative based rather than transaction based, if they welcome initiatives on transformation. So it kind of, goes hand in hand to what I asked before.
Thank you. So the question is regarding the shift to more transformational a more transformational logic to our program, right?
Yes. Exactly.
And how the Koreans reacted to this. Well, it's been a slow transformation. When the humanitarian aid program started, it's become slowly more sophisticated. I mean, we've gradually built it up and gradually started building up this project approach and acquainting the DPRK authorities with this project approach and the idea of capacity building, so that aid is no longer recognized as being the delivery of equipment. Rather, we wanted aid to be considered a process and a learning process. And this is firmly in line with policy in all countries. So this is why it was essential for us to do it, and also because it's responding to the needs in the country. So because it was quite a slow change, the DPRK authorities gradually reacted well to it. I mean, they do recognize now that this is the way we want to implement our program. So now onto the question on if we're trying to look at other ways of implementing our aid and perhaps cooperating with others still on the ground, as you said, Tereza. But my understanding is that the mobility restrictions are affecting everyone on the ground, not just the European organizations. So the option of working through non-European organizations is not really there, as far as I understand. Also, the issue of the mobility restrictions remains, and projects, in order to be implemented, require international staff to be there in the country, but also mobile, so that the projects can be monitored. So in a similar way to the COVAX issue, there needs to be a kind of guarantee that funds can be monitored by the international staff. So this is why we don't really see at the moment how this can be done with the current policy of the total lockdown.
Right. Yes. Thank you. I mean, as you rightly said at the beginning, or I think he said that actually, the epidemic measures may have worked quite well against the pandemic, but obviously they have really high costs in other areas. But let me now move more to the southern side of the peninsula. Well, there's one sort of bridging question asking what can be a future of North-South cooperation on COVID, either in terms of medical assistance or vaccines. So I don't know if you would like to respond to that one, but also I would have one question for June and then later on for Erwin. But let's start with June. You really well describe, the slow procurement process, but what do you think was the major cause? I mean, was basically South Korean government just sort of victim of its own success in the first part of the epidemic, or were there any other underlying issues? And also, perhaps, did you see any cooperation? Because you talked a lot about the US ROK cooperation and vaccines coming from the US. Have you seen any European cooperation with South Korea in that regard?
That's quite a mouthful. I'll start with the reasons as to why the procurement was delayed. South Korea could be seen as a victim of its own pandemic governance response, because you're right in the sense that when there was no clear assessment on when the vaccines would be available and whether they would be good for human bodies, the features of the vaccines were not very clear. And in addition to that, South Korea had not built up its research capacity in terms of inventing a vaccine at this kind of a very short-term span. Even countries like France, Sanofi eventually gave up, and Eli Lilly or Merck also in the US. Not all pharmaceutical companies were successful in achieving that goal, and South Korea is still in the phase of development, treatments, as well as vaccines. But I think what was really crucial is that politically, the motivation to secure vaccines at an earlier stage was met with hurdles, bureaucratic hurdles, because previously there had been instances in which South Korea procured a huge amount of vaccines for another case, and this before COVID, and then there were leftovers, and that became the center of criticism for bureaucratic underperformance, for not being able to predict and calculate the right doses for necessity. And that sort of led to the public health officials to rely on public cooperation and social distancing and all of these measures that were convened in the first year of the pandemic, which led to frustration, as I showed you in the shown in the approval ratings. Towards the end of year, people got frustrated about when this would end, because many who are in small businesses, small enterprises, they were not able to operate their stores. They were not able to convene their economic activities. So in a sense, the arrows pinpointed at the Blue House led to one of the experts. Her name is Moranki, who discouraged the government from early procurement. And that became a huge controversy in the earlier part of 2021. Another thing to note is that after the US-ROK summit, actually before the US-ROK summit, there was a lot of conversation domestically about what to get from the US. And vaccines they were on the top of the list, but what to give in order to get the vaccines. And one of the research collaborations I'm doing with another colleague of mine who is from Taiwan is looking at how semiconductor foundry establishment deals were given as an exchange to get the vaccines. So at the US-ROK summit, South Korea, Samsung pledged $17 billion to build a foundry. It's not decided where, but Samsung operates a factory in Austin in Texas. TSMC of Taiwan operates some foundries in the US, but the Biden administration, based on the global shortage of chips, demanded TSMC to build more in the US. So TSMC decided to deliver 6 more foundries. That's a lot of money. And basically what happened in the sense of these relationships, asymmetrical relationships, one side has vaccines, one side has semiconductor production capacity, you end up exchanging. And I do not think, for the life of me, that South Korea could have acquired those MOUs signed had Samsung not offered the foundry deal. So this is clearly geopolitics. And although South Korea was an early participant in the COVAX facility, and it did obtain a generous amount, probably 1/3 of the entire amount came from COVAX, but 1/3 is not enough. And what became very clear in the phase of the vaccination procurement process is that COVAX alone will not do the job. So in a sense, you need to mobilize diplomatic channels, you need personal contacts. Even getting to the year of Pfizer CEO or Moderna CEO, you need personal contacts. So in the end, it all comes down to how much overall capacity a country has in terms of geopolitics. So that's why I didn't really see any cooperation coming from the EU side, other than individual contracts. The UK has engaged recently in a swap deal with South Korea, but South Korea pledged to give the same dosage to Vietnam. So now it's starting to affect South Korea's New Southern policy as well, because you get some from a developed partner, and then you give some to another partner that is lacking more than yourself. So this will be a spiral of several countries in the making. There would be tiers of countries that are able to produce it, not able to produce it, but able to produce under a license, and then countries that can't produce at all. So there would be like the ranking of countries in terms of vaccine delivery. And I think when it comes to North Korea and South Korea collaboration, the dots are not there in order to do that, unless South Korea just says, oh, I can give this for free. I don't want anything back. I can just give this for free. And that is very much unrealistic given the time period toward the presidential election. That's my honest assessment.
No. Yes, well, thank you for your very honest assessment. And when it comes to Europe-Korea collaboration, maybe there would be scope for improvement, I think, in this area, despite the fact working on COVID has been one of the key points for EU-South Korea collaboration since June 2020 summit. But as I can see, at least on the vaccines, it hasn't produced that much. You've talked a lot about sort of contrasting South Korea and Singapore, especially in terms of digitalization. We are running out of the time a little bit, but I would still like you to say a few words, if you can, because for me, this is probably one of the biggest lessons, especially for the Europeans. If you could sort of draw some lessons on how these two countries approached it, in terms of also protecting data privacy, which has been always a big concern for the Europeans. And if you would like to also include some, final remarks about any other mutual lessons from your research.
Thank you for getting that. As I alluded to at the start, actually I found Taiwan to have been the most successful of the three countries in my paper with KAS in terms of ensuring effective data protection. If you have a chance to read it on Medium, you'll find that I put a lot of emphasis on the extent to which the authorities have really managed to establish a relationship based on trust between the institutions, law enforcement, health authorities, and the general public. Well, in the case of the ROK in Singapore, this relationship of trust is not quite been there to the same extent. So I'm not that sure how, I think the extent to which we can derive lessons from the ROK and the Singapore examples has to be qualified. In the case of the ROK, as I mentioned, there were a number of shortfalls that emerged into the fore in the summer of 2020. So also that I think it's going to be quite difficult to ascertain the extent to which the ROK stands as a good example of that. Because the reality is that, yes, you did have data privacy protections built into the ROK's public health measures, and intended to safeguard the kind of people's private data that was getting accessed via contact tracing, but you still had shortfalls. In the case of Singapore, the fact that the digital contact tracing data was itself directly linked into the Singapore government's Safe Entry app, and the later public revelation that, yes, this data was basically being made available to police operations, has also further undermined the level of trust between the public and the law and public institutions. So on that basis, yes, I know I'm speaking a bit departing from my case study, but as I said, the Taiwanese case study was probably the best example in terms of having a long pre-COVID track record of trust between the public and their institutions.
Well, thank you very much. We heard a lot about Taiwan in the first panel, so thank you for bringing this up. I know we are sort of 5 minutes past the time, but I would like to give everyone a chance to say a few concluding words. So, June, I will go back to you. If you would like to just have some final remarks that maybe in terms of, all the mutual lessons from all your research, not just perhaps specifically on the vaccine procurement, what would you say is especially useful for, averting future pandemics or at least mitigating them?
In closing, what I'd like to focus on is the point that I could not address fully in the presentation that I gave. The whole intent of the presentation that I gave as I work towards finalizing the paper is to point out the limits of the multilateral framework, COVAX facility, or any other means of multilateral work that is exposed in this pandemic. And if we look to the kinds of exchanges for vaccines or any kind of collaborative efforts that occur at a bilateral level between countries, we see that this is not just about overcoming the pandemic, but there is a structuralization, a new sort of shaping of the global order based on who has the capacity. And I think it would be very important into the coming years to assess country capacities and what countries can do with it, wielding power based on their capacities. This is important because, as I mentioned in my comments just now before, that semiconductors become very essential because of the AI, internet-driven global economy. And vaccines, for one, they're also a part of the supply chain that's becoming more and more weaponized. So in a sense, when we're looking at these post-pandemic era efforts, it would be very important for not just public health experts, but also IR scholars, anyone who is interested in comparative politics, to see how countries are doing what with these capabilities. And if they don't have these capabilities, what kind of limitations could be fulfilled by countries that have, and the intent to fill those holes, because I don't see that happening at the moment.
Right. Well, thank you. Thank you. That's also encouragement for all of us to focus some of our work on these issues, as you highlighted. Maybe now moving to the northern part of the peninsula, and there's one question for Key and possibly Juan, and I would also like to ask you to include your final comments, and that is on North Korea's, sometimes a tendency to even hack some manufacturing labs and companies. So do you think that actually North Korea would be able to establish its own research capacity or perhaps research development when it comes to vaccine production, or something like South Korea has done, to kind of license foreign vaccines and produce them at home? So that would be more in terms of the capacity, a question for Key, and perhaps question for Juan, if European Union would be willing to support something like this, as a kind of aid to the DPRK. That would be quite obviously a novel approach to allow them to produce their own vaccines and potentially treatments, and that would have to, of course, go hand in hand with ability to import medical equipment. If you can just shortly react to this and say a few concluding words, and then we'll close this panel. Thank you.
Sure, I can go first. So North Korea has the technical capabilities of creating biologically active proteins. So they have gene splicing technology. They're able to make hormones, for instance. So they can create things, vaccines like the AstraZeneca vaccine, as far as making it. Now, testing is a whole different story, right? They have to make sure it's safe and efficacious. But they are interested in developing additional vaccine development and manufacturing capabilities, and it could be an entry point for discussion for health engagement with North Korea. I will close by saying that I really enjoyed this panel, and I think it's because I normally talk to other public health practitioners, and so I'm sort of an echo chamber, but I'm here with social scientists, political economists, and humanitarian organizations, and I'm, as a public health specialist, bringing it. So health cannot be solved by it's not a technical solution. It requires a sort of a multi-discipline approach to it. And I really enjoyed this, and I think we should have more of these.
Well, thank you very much. Juan?
Thanks. So firstly, in response to your two questions, I can't really answer it any better than Key did on the DPRK's manufacturing capacity. Just speculating here, I mean, the idea might be more appealing to the DPRK. Instead of relying on a foreign country, then the idea of producing the vaccines there might actually be more appealing to them. In terms of supporting the DPRK's production of vaccines, this would be quite problematic, I think, because the current humanitarian aid to the DPRK is implemented through humanitarian organizations. I think what you were suggesting, Tereza, was that humanitarian donors support the DPRK government by sending supplies and materials to produce vaccines directly by the government. So this is really a much more problematic issue, which really would not be possible at this stage because we work through humanitarian organizations. And with the sanctions there, this would be extremely difficult, I'd say. Nevertheless, the idea of cooperating on vaccines is out there. It's recognized that it's a potential open door for cooperating. So this is why it was a bit disappointing to have the rejection under the COVAX facility. But yes, we will continue to follow up on the situation. And actually, regarding the delivery of vaccines, it's not DG INPA, which is the DG which would be primarily in the lead there. It's actually another department in the EU, in the Commission, DG ECHO, which has a more strict humanitarian mandate. So it would be really a question more for them than for me. In terms of my last words, so I hope my presentation was informative. It's not a good situation, but I think it's important that people are aware. So I was happy to share that with you today. Thank you.
Yes. Well, thank you very much, Juan, for both your presentation and both your suggestions. Maybe next time I will also try to bring your colleague from DG ECHO on board. We had your colleague from DG Cente earlier in the morning. But I would sincerely really like to thank all of you for engaging on this panel, both from the academic and practitioners' point of view, and also, as Key pointed out, across the fields and across the time zones and continents. So that has been wonderful. So thank you very much. And I think to say a proper thank you, I will give words to Professor Lee Eun-jung, who just appeared, who is the head of the Korea Europe Center. So Eun-jung, please.
Oh no, I just want to say thank you, Tereza. It was wonderful. How do you organize these two panels? I enjoyed very much. As Key said, it is really good challenge to mix these practitioners and scientists and from social science and humanitarian aid too. So we will try further to create such a debate places here. Thank you.
So thank you very much. Thank you. And I will just say, well, I hope to see you next time. Bye-bye.